Defendants' illegal deployment of artificial intelligence in place of real medical professionals to wrongfully deny elderly patients care owed to them under Medicare Advantage plans by overriding their treating physicians' determinations as to medically necessary care based on an AI model that defendants know has a 90% error rate. You ever read the book 1984? Sure seems like that's what Orwell was talking about here. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. We are now on day 6 of the manhunt for the killer of UnitedHealthcare CEO Brian Thompson, and the media is spending a whole lot more time condemning and scolding Americans for expressing glee that a for-profit healthcare CEO was gunned down than actually lifting the hood and dissecting the rot and corruption at the root of America's health care system. And we are here to actually lift that hood. I want to go through a lawsuit that you might have not heard about against UnitedHealthcare for deploying artificial intelligence to deny Americans that are owed health care of upwards of 90% of the time. You will not believe this healthcare Hunger Games that across the board healthcare companies are now deploying, but UnitedHealthcare in particular was sued for last year. Before I get to that, I want to show you this because the quote stood out to me. This is from a Fox News article about big corporations, industries scrambling right now for enhanced security for their CEOs. Quote, his methodical and calm fixing of the weapon, referring to the killer who's still at large, when it jammed, likely sent an ice pick of fear into each of the chief security officers. It is exactly this type of apparent professionalism, linear focus on his mission, and precise exit strategy, coupled with specific intelligence as to the target's movement that kept chief security officers up at night. An ice pick of fear. Again, to be clear, not telling you to go get your guns and gun down anyone. I don't think violence is the answer. With that said, interesting that these companies, their ice pick of fear is as to the skill of the shooter and not actually examining why exactly do millions of people hate us and are expressing glee over the murder of a CEO. Maybe we need to reevaluate our practices. Maybe we need to reevaluate this whole industry. April Fools. No. How do we build higher and more barbed wire gates around our CEOs who preside over the mass killing of millions of Americans? Now, on UnitedHealthcare in particular, I want to bring your attention to a practice that has not been getting a ton of attention in the mainstream media, and that is companies like UnitedHealthcare deploying artificial intelligence to increase their denials, their wrongful, what should be illegal denials of care. In the case of UnitedHealthcare, upwards of 90% of the time. Let me show you this clip. If you don't know, we routinely are one of the only independent outlets in America on the ground covering protests that mainstream media and a lot of independent media ignore. Here is coverage of a protest we did last year where somebody who lost their father specifically discusses how artificial intelligence was a main driver.
We later learned that a lot of these denials were because Medicare Advantage is running through medical decisions through an algorithm, using bots, listening to bots, instead of the doctors who knew my dad. Right. Living this trauma, witnessing this trauma, opened my eyes to the cruelty of privatized Medicare. So I'm here today to continue to fight for my dad and to honor his legacy as a social justice advocate. I know that denying my dad's care increased profits somewhere, but it stole things from us that are invaluable. Quality time together, dignity. Through all of these denials, having to continually appeal, it would continue to upend our lives and cause so much stress and trauma. So I'm here today to ask you to continue to speak out and fight for those who have passed but deserve better, for those who are with us today, that they get the care they need when they need it. No denials, no AI, no Medicare Advantage. Medicare is a social system that is supposed to be here to protect us all and provide us health care for all, and we need to return it to that.
And as is typically the case, we were the only outlet out there, including local media. Wasn't even out there. Please support us for as low as $5 a month. It is expensive to do actual reporting, but so important. So there's a lawsuit that was filed last year, specifically against UnitedHealthcare for their deployal of artificial intelligence. It's on behalf of two deceased plaintiffs. I have gone through the trouble of reading the whole thing, so you don't have to, but I'm going to highlight what I think are the important parts here, because the mainstream media just seems not to be so interested in the healthcare hunger games that CEOs like Brian Thompson have deployed. Again, this was filed last year. I'll read just some of it to you. This putative class action arises from defendants' illegal deployment of artificial intelligence in place of real medical professionals to wrongfully deny elderly patients care owed to them under Medicare Advantage plans by overriding their treating physicians' determinations as to medically necessary care based on an AI model that defendants know has a 90% error rate. Despite that high error rate, defendants continue to systematically deny claims using their flawed AI model because they know that only a tiny minority of policyholders, roughly 0.2%, will appeal denied claims, and the vast majority will either pay out-of-pocket costs or forego the remainder of their prescribed post-acute care. Defendants bank on the patient's impaired conditions, lack of knowledge, and lack of resources to appeal the erroneous AI-powered decisions. The fraudulent scheme affords defendants, UnitedHealthcare, a clear financial windfall in the form of policy premiums without having to pay for promised care, while the elderly are prematurely kicked out of care facilities nationwide or forced to deplete family savings to continue receiving necessary medical care, all because an AI model disagrees with their real live doctors' determinations. And by the way, you're seeing companies all over this country, not just in healthcare, in finance, Wall Street, Silicon Valley, start to deploy AI. So get ready, folks. You're going to start seeing this a whole lot more. Let me read you more about this before I get to the patients in specific. Defendants, UnitedHealthcare, state that their mission is to, quote, help people live healthier lives and make the health system work better for everyone. In reality, defendants systematically deployed an AI algorithm to prematurely and in bad faith discontinue payment for healthcare services for elderly individuals. Defendants' AI model, known as NH-Predict, determines Medicare Advantage patients' coverage criteria in post-acute care settings with rigid and unrealistic predictions for recovery. Relying on the NH-Predict AI model, UnitedHealthcare purport to predict how much care an elderly patient should require, but override real doctors' determinations as to the amount of care a patient in fact requires to recover. As such, UnitedHealthcare makes coverage determinations not based on individual patients' needs, but based on the outputs of the NH-Predict AI model, resulting in the inappropriate denial of necessary care prescribed by the patient's doctors. Defendants' implementation of the NH-Predict AI model resulted in a significant increase in the number of post-acute care coverage denials. You ever read the book 1984? Sure seems like that's what Orwell was talking about here. And here's just a visual if you want to see. I mean, it gives me a headache. I don't know about you, but here is how their AI NH model works. They have number scores here, 38, 3 hours a day, basic mobility, daily activity, 27, applied cognition, 52. I guess they add up the numbers to some formula. This is not how healthcare should work. This is literally a bot or robot choosing between life or death. Likelihood of hospital admission from SNF in less than 30 days, 34%. I mean, this should be illegal. It should absolutely be illegal. Yet, United Health Group and Care are lobbying the hell out of the government. And they are spending millions and millions, hundreds of millions on lobbying and direct political donations, including, as I told you in a video 2 days ago, to Kamala Harris, Donald Trump, the DNC, the RNC, and all the rest of the politicians. Check out our videos from the other day if you want to know who gets the most. Let me read to you two deceased plaintiffs that this lawsuit is on behalf, and you can kind of see the kind of folks that tend to get victimized from this. Plaintiff, the estate of Dale Henry Tetzloff, represents the interests of Dale Henry Tetzloff. On or around October 4th, 2022, 74-year-old Mr. Tetzloff suffered a stroke and was admitted to the hospital. You know, happens with older folks. At the hospital, his doctor referred him to SNF to receive post-acute care, determining that he required post-acute care for at least 100 days. In or around November 22nd, defendant UnitedHealth Group notified Mr. Tetzloff that his coverage was denied. He had only been at SNF, the facility for his post-stroke care, for 20 days. So, doctor, facility says you need a 100-day. The AI bot, the wise algorithm that UnitedHealthcare is deploying, they say, you're good with 20. Get the hell out of here. Mr. Tetzloff had no choice but to pay for his medical expenses out of pocket. He and his wife, Kathleen, appealed the coverage denial. After their second appeal, one of the defendant's doctors finally reviewed Mr. Tetzloff's medical records and agreed with the referring doctor that he required additional time to recover from his medical condition. However, after 40 days at SNF, defendant UnitedHealthcare again denied Mr. Tetzloff's coverage, determining that he was ready for discharge. Mr. Tetzloff's doctor contacted UnitedHealthcare to inform them that Mr. Tetzloff was not ready for discharge and required additional care, including occupational therapy and physical therapy, to recover. Nonetheless, defendants failed to reverse its decision to deny coverage. Mr. Tetzloff contacted defendants to inquire about the reason for denying his claim. Defendant refused to provide any reason, stating that it is confidential. Our evil is proprietary. You cannot have access to our rationale because it's not actually a human making the decisions. Mr. Tetzloff and his wife continuously appealed defendant's denial of coverage, but defendant failed to reinstate Mr. Tetzloff's coverage. Mr. Tetzloff out-of-pocket expenses exceeded $70,000 over approximately 10 months. He was discharged in June 2023 to an assisted living facility where he passed away in October of 2023. Now, I don't have access to his medical records. I'm certainly not a doctor, but you tell me, you're 74, you have a stroke, obviously affects, your brain, your motor skills, could affect your face. You could have partial paralysis. My grandmother, before she died, had a stroke. Then you have to deal with the additional stress of UnitedHealthcare denying you to stay at your treatment facility, the additional stress of having to scour your accounts, your savings, maybe ask family, friends for help to pay out of pocket. You don't think that contributes to a deterioration of health for which you then die? Seems he only died at 74 or 75 years old. I mean, not young, but not, could have had a couple more years left. There's a pretty thin line between physical and mental health, and one does affect the other. So how many people are having their lives shortened just due to the stress of dealing with this healthcare Hunger Games and faceless robots making decisions on healthcare? It is absolutely outrageous. And we're sitting here talking in elections and in the media about democracy is at stake. Well, what kind of democracy is it if you go to vote, you pay your taxes, you have money taken out of your paycheck for, 30, 40 years of your working life for Medicare, for Social Security, what they call entitlements, but you are entitled to it because you paid for it. And then you are literally being threatened or literally thrown out into the streets because a lot of people wouldn't have been able to pay for $70,000 out of pocket and would have had to leave the treatment facility prematurely. This is not a democracy. This is an oligarchy. This is a economic Hunger Games, or in this case, a healthcare Hunger Games. Now, I'll tell you the other defendant who was even older and were taught to treat our elders and our, the elderly with respect and dignity in certain cultures, even more so. Well, here's how 91-year-old Gene Locken was treated. Plaintiff, the estate of Gene B. Locken, represents the interest of Gene B. Locken. During the relevant period, he was enrolled in the Medicare Advantage plan provided by defendants. On or around May 5th, 2022, 91-year-old Mr. Locken fell at home and fractured his leg and ankle. He was admitted to Asperis Tomahawk Hospital. Prior to discharge from the hospital, Mr. Locken's doctor recommended that Mr. Locken be admitted to Asperis hospice care because his health began deteriorating. He was 91. On or around May 11th, 2022, Mr. Locken was admitted to Tomahawk Health Services as a hospice resident. He was very weak, not communicative, and in constant pain from his fractured leg and ankle. After a month of skilled nursing care with no physical activity, because his fractured leg and ankle were still healing, Mr. Locken began to show signs of mental and medical improvement. On or around June 24th, 2022, Mr. Locken's orthopedic doctor assessed his fractured leg, removed the splint, and placed him into a removable ankle boot. The doctor indicated that physical therapy could start working with his weight bearing as tolerated for ambulation and transfers as long as the boot was on at all times. Initial visit to physical therapy began over the next 2 to 3 weeks. The physical therapist indicated that Mr. Locken was slowly building his strength and mobility, but continued intensive physical therapy was medically necessary. From July 1st to July 20th, 2022, UnitedHealthcare covered the cost of his post-acute care at THS. However, on or around July 20th, defendants terminated his coverage, explaining more inpatient days at the skilled nursing facility are not medically necessary. A safe discharge has been recommended. Yes, a safe discharge for the 91-year-old who could barely walk. Defendant's denial of coverage dumbfounded Mr. Locken and his treating physician because he was still recovering from the fall and had only been receiving physical therapy for 2.5 weeks. His muscles lacked strength after a month of physical inactivity, and he was learning again to balance while being fully weight-bearing. Medical records submitted to UnitedHealthcare for review indicated that he was not ready to go home. Specifically, the physical therapist note stated neuromuscular, decreased movement mobility, musculoskeletal, paralysis, weakness. However, defendants did not review these records when deciding whether Mr. Locken requires additional post-acute care. Locken and his family immediately appealed UnitedHealthcare's decision to deny coverage. On or around August 1st, Mr. Locken received a letter from UnitedHealthcare stating that his appeal was rejected. In the letter, UnitedHealthcare explained that there was no acute medical issues because the patient was self-feeding and required minimal help for hygiene and grooming. This determination went against the physical therapist's recommendations and notes describing Mr. Locken's muscle function as paralyzed and weak. Translated, we're cashing your premium checks. Your heart is beating. You can kind of clean yourself. So if you can't walk, that's okay. Walking is not really a necessity for life. You're 91. Go on your way. May God be with you. Mr. Locken and his family continued to vigorously appeal UnitedHealthcare's denial of coverage, but they refused to cover the treatment repeatedly and wrongfully denying his coverage for his medically necessary needs. Mr. Locken's family had no choice but to pay out of pocket in order to continue providing care. They paid out of pocket between $12,000 and $14,000 per month from July 2022 to July 2023. 12 to 14 grand a month for a year. He remained in the skilled nursing facility until he passed away on July 17th, 2023. Remember that ad a couple years ago when Paul Ryan was going to throw Granny off the cliff? Well, this is actually throwing Granny off the cliff. Just a faceless algorithm that UnitedHealthcare is deploying so that its CEO, who was just gunned down, could make $10 million a year. God knows how much more he was making, in stock incentives and dividends, and the shareholders, of course. But we want to sit here talking about Trump, democracy, fascism. Trump is a threat, but I got news for you. We already have no democracy. And I would say when the corporate state actually merges with the actual state, that's corporate fascism. And a lot of authoritarian, deadly fascism across the globe at the root was economic desperation and anger. Well, this is justifiable economic anger and desperation. I want to show you more from our on the ground coverage over the years. Here is another protest we covered in New York City, where Eric Adams, the New York City mayor, who somehow is still in office, despite his scams across the globe, for which the FBI and DOJ have been investigating and indicting him, Eric Adams was trying to take away elderly New Yorkers, seniors who paid into Medicare, basically pull their Medicare and put them all on privatized Medicare Advantage plans, like the one that prematurely probably killed these two older people.
We are as strong and determined as the French. Just like them, we will not give up until we have the health care we were promised. Whoops, I just lost it. The city has reneged on a contract it had with us when we were active workers. The bargain was sacrifice wages now, but when you retire and when you need it most, you will have publicly funded, premium-free, quality health care. Yesterday, with one stroke of his pen, and no doubt to preempt this rally, the mayor broke that contract with us and instead signed a contract with Aetna. A private, for-profit health insurance company under investigation for fraud, and whose loyalty is not to its clients, but its shareholders. Their bottom line is more important than our lives.
There is an African proverb that says, working together, the ants ate the elephant. Let me say it again. Working together, the ants ate the elephant. Now, we are the ants. We symbolize right and justice. And the city bureaucracy, the healthcare companies, the insurance companies represent the elephant. They represent greed and power. But let me tell you this, colleagues, fellow retirees, we are in the fight of our lives.
And by the way, Trump began efforts to privatize Medicare through the back door, and Biden continued it. So what do you think is going to happen under President Trump 2.0? We will continue covering this, and I very much hope, even if and when they find this killer, that this anger and this attention on the evil for-profit healthcare system does not go away. This is one of the stories of our lifetimes, and we will continue covering it.